Hi guys, we are going to do anesthesia or recall session. Okay, paper was little bit lengthy, right? And as far as I have got, there were less images, not like 50 80 images, 30 40 around, right? As per anesthesia per se, the question were little bit easier side. Okay, so let's start the anesthesia recall. Before that, disclaimer, paper was lengthy, right? So question language might be different, so I have tried to grab it as much I can from the students. On that basis we are going to do this recall session. Okay, कुछ भी हो जाए पेपर में, चाहे पास हो जाओ चाहे फेल हो जाओ, अभी जो 10-15 दिन है रिजल्ट आने के, उसमें एक याद रखना है, लोड नहीं लेना है. ओके, जो भी हो ऊपर वाले पे छोड़ दो. अब 10-15 दिन रेस्ट करनी है अच्छे से. ट्रिप पे जाओ. दोज हु हैव स्टेड एट दिल्ली, प्लीज गो बैक टू योर होम. ओके, chill. Now let's discuss these questions. First one which came in your exam was identify the graph. Very easy. The answer is EtCO2, right? End tidal CO2 level. It is a confirmatory test for anyone? It is for correct placement of ET tube in patient's airway, right? You know this, we have discussed this in class very well. So answer is EtCO2 over here. Second question, patient being operated in OT, during surgery patient suddenly developed high body temperature, tachycardia and increased BP and sweating. So all of you are well aware of with this question. What is the answer? Answer is malignant hyperthermia, right? Malignant hyperthermia. And if you know, malignant hyperthermia happens because of what? Because of defect in ryanodine receptor 1, right, on the sarcoplasmic reticulum. Defect in which channel? Channel which is defective is calcium, right? And it happens because of which anesthetic agent? If you can recall, it happens due to all halogenated inhalational anesthetic agent, right? And I have specifically told you in the class, please remember two drugs. One is halothane, right? Maximum happens due to halothane. Second one which I have told you to remember is succinyl scoline, right? And there is one more which, because of which we can have malignant hyperthermia, that is lignocaine, right? That is lignocaine. But as I told you, you should remember it is very rare chances that we can have malignant hyperthermia due to lignocaine. Okay, all right. Drug of choice, anyone? Drug of choice is dantrolene, correct. Right? This is repeated question, came in your exam continuously for 3 times. So hope all of you have marked this correct. Now let's go to the next question. Patient is planned for laparoscopic appendectomy in a daycare surgery setup, right? Why we cannot perform daycare surgery on this patient? Option where patient lives 45 minutes drive away from the hospital, right? Patient is ASA grade 3. Just a minute. Okay, yeah. Patient is 45 minutes away, first option. Second is ASA grade 3. Remember, these are relative contraindication. These are relative contraindication, right? The absolute contraindication for this is there is no one at home to take care of the patient. There is no one at home to take care of the patient. So what can happen, suppose patient is having multiple episodes of vomiting at home and patient goes into shock, right? Someone has to bring that patient to the hospital, right? If there is no one at the home, patient can die of the shock. There might be reactionary bleeding. So because of this, absolute contraindication is there is no one at home to take care of the patient. किसी को तो पेशेंट को हॉस्पिटल घर से लेके आना पड़ेगा ना, राइट? सो बेटर आंसर ओवर हियर इज नो वन एट होम टू टेक केयर. Okay, hope you have marked this correct. This is repeated question. This question has been asked in your exam 3 to 4 attempts before as well. They have asked you over here most common nerve used in TOF monitor or neuromuscular blocker monitor. The answer is it is ulnar, right? Ulnar. I will give you a trick. From that you can remember the bone and nerve as well. Locate the thumb on the image. The bone which goes on this side is radial, opposite is ulnar. So ulnar nerve, ulnar bone, radial bone, radial nerve. Okay, this will help you to solve the questions from orthopedics as well as anatomy. There is no paper where they are not going to ask something from radial and ulna, whether it can be bone, nerve, or it can be artery. So this was the question related to this. Now tell me most common muscle used in neuromuscular monitoring. It is adductor pollicis. And why do we use neuromuscular blocker monitor or train of 4 monitor? It is to check the doses, right? कितना उसको ड्रग देना है, कितना कम करना है, और to check the effect of neuromuscular blocker drugs, right? This question has been asked in your exam 2 to 3 attempts before as well. Next question. Patient came to emergency in unconscious state, decrease in SpO2, and patient had respiratory distress as well. The question which students gave me, I have made this question according to that, right? Despite of doctors being trying to intubate and ventilate the patient for 20 minutes, it was written over there. Okay, 20 minutes, I have got so many reviews for this, right? And patient condition is worsening. What is the next line of management? See, this question is tricky. Ultimately, you know the language and the examiner know the language. But if they have written clearly trying to intubate and ventilate, still patient's condition is deteriorating, that means unable to intubate and unable to ventilate, unable to intubate, unable to ventilate, that time we are going to perform cricothyroidectomy. अगर पेशेंट वेंटिलेट हो रहा है, then answer might change to laryngeal mask airway. Okay, I am giving you 2-3 scenario. Third question which can be asked or may be asked, best line of management over here. If we are not able to intubate, then best will be tracheostomy. Okay, because tracheostomy is also definitive airway. Okay, so these are three scenario by that question can be tricked. Okay. Definitive tracheostomy, unable to intubate, unable to ventilate, cricothyroidectomy. Cricothyroidectomy is an emergency procedure, right? And patient is able to ventilate, SpO2 is increased, then answer is LMA. Okay, these are three scenario. By this we can trick the question. An adult patient is intubated, kept on mechanical ventilation after some week. Now I am not sure, it was written some week or few days. Okay, if anyone can recall, let me know. Patient developed inspiratory stridor. First of all, this is not the question from anesthesia side, this is from ENT. Okay, correlated with anesthesia. Kindly check this question with ENT peoples, they can give you correct answer for this, but still patient is on mechanical ventilation and for some weeks, so I am considering this patient for more than 3 weeks. Okay, because at least to develop laryngeal granuloma, or you can call it as subglottic stenosis from ENT, right? Subglottic stenosis, it happens due to rough intubation, right? So patient might have developed some granuloma over there, or might be there is a laryngeal edema as well. So from my side the answer will be subglottic. Okay, subglottic stenosis hota hai, right? You would have studied this in ENT. Same, the answer is subglottic over here. If they have not written some weeks and they have written few days, and the option is, I am giving you the option E, that is larynx involvement. Okay, or laryngeal area. Best answer is laryngeal area, because chances of having laryngeal edema after intubation goes with laryngeal edema. Okay, ये हो सकता है, और एक हो सकता है कि patient was intubated and after intubation within some few hours patient is having severe respiratory distress, SpO2 is dropping, there is wheezes or stridor, the answer goes for severe laryngobronchial spasm. Okay, तब भी आंसर larynx involvement फिर से आएगा, because we use anesthetic drugs, because of that patient can have bronchospasm, severe bronchospasm can be there. Okay, so do comment on this question. I will try to give you best answer whenever I will receive the better question. Okay, the purpose of cuff in tracheostomy tube, they have marked this structure and they have asked you that why do we have cuff over here. While we were when we were attending anesthesia classes, I told you the purpose of cuff is clearly to prevent aspiration. It is to prevent aspiration, it is not for fixing of any kind of tube. Okay, tracheostomy tube को कहाँ fix करते हैं हम? From here we will take a bandage or thread, पीछे connect करेंगे इसे, right? पीछे की तरफ tie करते हैं. Same goes with endotracheal tube. Where we fix the tube? We fix the tube at the angle of mouth. Cuff का काम क्या था endotracheal tube में भी? To prevent the aspiration, right? So answer over here is to prevent the aspiration. Okay, no doubt with this, no issues with this. Okay, let's go ahead. Patient came to emergency with palpitation, sweating, BP is around 90/70. Okay, ACG is being done. Now what is the answer over here? Sawtooth appearance, that is PSVT, right? PSVT ECG दिया हुआ था. Now over here we are going to follow adult tachycardia guidelines. I have the confusion if option was DC shock. If they have asked you about the drug, you know the drug which we give, that is amiodarone, right? But if they have given you DC shock in the option, you need to mark DC shock, okay, because patient is vitally unstable. Okay, so better answer will be DC shock if it was in the option. So do let me know what was the option over there. There was the question regarding opioid poisoning, right? Pinpoint pupil was written, right? Pinpoint pupil. Two drug was there that can confuse you. One was naloxone and second was naltrexone. Better answer is naloxone. If it was not in the option, then answer should be naltrexone, right? Antidote for opioid poisoning. This question nobody has discussed, and this question has been given by the students. Some new guideline name was there, and they have asked in anti-diabetic patient when we should stop a diabetic drug, and option were 1 week, 3 week, 4 week, 6 weeks, right? Kindly tell me which guideline name was there. It was AHA, ADA, or any other guideline. Let me know this, then I can give you a better answer. But still, see, hyperglycemic patient will be in the danger when we are going to operate inside the OT, right? Answer is 1 week. Okay, why I am telling you 1 week, irrespective of the guideline name, we can use we can stop SGLT 1 or 2 drugs before 1 week. Reason, to prevent the aspiration. Okay, so irrespective of the guidelines, the answer will be 1 week. Okay, closest is this one only, so 1 week is the answer. Do let me know in the comment, okay, कि कौन सी guidelines थी इसके अंदर. Okay, that was all about the anesthesia. There were 7 to 10 questions were there. We have discussed this in rapid revision of Medenxt app as well. Who have subscribed or who has the access, they would have solved at least 7 to 8 questions from the rapid revision itself. Okay, if you have any doubt, let me know on my Instagram ID. Okay, you can comment, I will try to reply that one as well. Okay, all the best with your results. कुछ भी हो, अब चिल रहो, ठीक है? हार हो या जीत हो, लाइफ में हर पन्ने पे हमें कुछ ना कुछ सिखाया जाता है, कुछ ना कुछ हम किसी ना किसी चीज़ से लड़ के आगे बढ़ते. तो अभी जो भी हो सब छोड़ दो, अब चिल करो, एंजॉय करो. ऑल द बेस्ट and thank you. Hope you liked the video. If you liked the video, please share to your friends as well. Okay, thank you.